Self-Management Week. Embedding Supported Self Management at the heart of Scotland's biggest health charity. Lynsey Duncan, Deputy Head of Clinical Services. Paula Leask, Self-Management Facilitator, Chest, Heart and Stroke Scotland. Follow us on X at Self-Management Scot and at Alliance Scot. Health and Social Care Alliance Scotland.
So you've heard about our strategic vision, how we went about identifying what the challenge was and then the solution, including the development of the No Life Half Lived model. But I'll hand you now over to Lynsey Duncan. Lynsey is our Deputy Head of Clinical Services, and Lynsey will talk to you a bit more in detail about how we've embedded those principles and the ethos of self-management into each of those individual services and what that's meant in terms of a whole model across all teams. So Lynsey, I'll hand over to you.
Okay, thanks, Joanne. So as Joanne said, I'm now going to look really into a bit more detail about how we have adopted self-management throughout all of our service delivery in Chest, Heart and Stroke Scotland, and really delve into the who, the why and the how. Next slide, please. So we had to really look as an organisation and see where are we at when we decided we were going to include self-management across all of our service delivery. And we had to look at what we were already doing in terms of service delivery and see, okay, where do we actually need to go in order to be able to do this successfully? So the arrows that you can see in the slide really show you where we started and where we're moving towards and the progression that we've made so far. So we had to look at moving ourselves over from individual practitioners to really looking at that whole team approach. And Joanne showed you that quite linear effect of our service delivery teams. However, as Joanne rightly said, anybody can dip in and out of that at any point. But we had to think of ourselves not just as our individual teams, but as that whole system approach so that we can fully support somebody to adopt the principles of self-management. We then looked at moving away from being the person that empowered someone with their condition to actually growing the relationships with that person so that they can feel empowered and that they can take control of their own condition. And we then moved away from the doing to and looked at the working with. Now, for me, who has a nursing background, that's quite a difficult concept. Through all of my nurse training, I was taught that I was a care provider, that I was the doer for the person. If I see somebody struggling to tie a shoelace, my instinct is to go and tie that for them. My instinct is not to work with them to see what they can do themselves. So we are very much approaching and adopting that concept in our organisation. And we then moved from expert clinician. Now, that's not to say that we're not experts in our own field within our own teams, but we stopped being expert clinician to the service user and we became a partnership with them and we work to coach them so that they can take control of their condition. And then we moved away from the historic what matters to me to the what matters to you, that holistic approach. And what I think might matter to you as somebody with a long-term condition might not actually mean anything to you. So making sure our conversations are meaningful and that our service delivery is meaningful to that person. And then finally, we looked at moving from that individual responsibility to that shared responsibility. So you're the person living with the condition. You and I can work through this together and I can support you. Next slide, please. So what did we have to do as an organisation? So as Joanne has talked you through how we identified that we were going to adopt self-management throughout all of our service delivery, but we then had to sit as an organisation and say, right, actually, how are we going to do this? So we had to look at quite a few things, and one of the first things we looked at was the skill set. So we had to look at the skill set we already had, and we across our teams have got a huge, vast knowledge of experience in our conditions, but we had to say, okay, this is quite a new concept. What is it that we need to do to invest in training to make sure that this is successful? So we started by delivering our services day at the end of last year, and that was a full day where we all came together in one room, and the theme throughout the whole day was self-management. And the Alliance came along and delivered a really fantastic workshop on self-management and really got us to think, what are we already delivering in terms of self-management? Because we were already doing quite a lot of it and doing a lot of it quite well. But we had to grow in that. And there was areas that we maybe thought, okay, we're maybe not covering that and we need to grow in that area as well. We then looked at delivering change management training internally by our HR department, because I think we could all agree it doesn't matter how positive, how much we adopt change, there's always a bit of anxiety when change happens. And we wanted to make sure that our teams came along with us on this journey and that they were positive and that they could see the value for our service users. We then looked at making sure that we used a consistent and evidence-based approach to goal setting. So we were doing goal setting already, but we weren't doing it in a consistent manner, and we were all sporadic in how we used it. So we've adopted the goal setting and action plan framework, which is an evidence-based goal setting framework, and we now use that across all of our service delivery teams so that we've got that consistent evidence-based approach, and goal setting underpins the principles of self-management. We then worked with the Thistle Foundation, and we said, could you come and deliver brief conversations to supported self-management to all of our service delivery teams? And that's been a real game changer. The feedback has been hugely positive, and we're already hearing a change in language throughout our teams and very much adopting the language of self-management. We then looked at the SMRC training. Now that is related to the 6-week self-management programme, and I'll speak a bit more in detail about that in a few slides' time. And we looked at new role development. We've got Paula in the call, and Paula will tell you all about her role just at the end of the session. And then we looked at the different training that was available in SMRC, which I will cover. Next slide, please. So the next thing we had to look at was the tool set, because we speak a lot about making sure our service users have the tools to self-manage, but what about the people that are actually supporting our service users? We need to have the tools. And although we had some of those tools already, we really had to sit back and say, what can we do to develop this and to make sure that this is a success? Some of this I've already looked at, and some I'll look at over the next few slides, but I think the things to really pull out from this was the development of a standard operating procedure, because we wanted to make sure that self-management was consistent and that it didn't matter on that diagram that Joanne showed you earlier, where the service user accessed our services, at what point, whether it was 1 team, 5 teams, that they have self-management, they have the offer of self-management in everything that we provide and everything that we offer for that service user. We are currently reviewing our health information, and that's an ongoing process because we want to make sure, first of all, our language is correct in terms of support and self-management, but also to make sure that we are covering the topics that we know are important to people that living with long-term conditions. And then we had to look at the documentation. So that's one of the tools that we needed. We needed to make sure that we had the documentation available to our service teams. And we use a digital system called D365, and that's a patient case system. And we needed to make sure that that was embedded in there, also so that we can collect the robust data that we require to prove the impact and the evaluation of the self-management programme. And the evaluation, again, I'm going to touch on in the next few slides. Next slide, please. So last, but by certainly not least, we had to consider mindset. This was a change in culture for us as an organisation, and quite a big change in culture. So we had our training that was already developed in there. We've now developed the tools that we require as an organisation to deliver it. But there was still a few things left to do to make this successful. So we had to review our current roles and our teams and structures, because we needed to make sure, one, we have the right skill set, but two, that we've got that infrastructure, because as Joanne said, we're hoping to roll this out to every health board by 2028, and we need to make sure we start building infrastructure to support that. So we had to do that bit of workforce planning in 24-25, and that will run through concurrently to 2028, to the end of our strategy. Again, evaluation, you can see there's a theme coming here, and that's why I'm keeping the theme in, and I will come back to that on my last slide. But evaluation is key to everything that we're doing as well. And also, we have to speak about that long-term change, because this isn't something that's here this week and next week we're going to be speaking about something else. We know the benefit to our service users of self-management, and this is here to stay, and we need to embed that culture in our organisation. Next slide, please. So one of the other things we had to look at was engagement, because we spoke very much about what we did internally as an organisation, but we needed to learn from other people, and we wanted to go out and have conversations and say, this is our thoughts, this is what we're thinking. 1, how do we do it? 2, how can we learn from you? So we reached out to health boards that we have current service delivery within. We started the conversations. This is our offer. Give us some feedback. Is this something you'd be interested in? We then met with Northern Ireland Chest, Heart and Stroke, because they already deliver the SMRC 6-week programme, and we wanted to learn from them. You know, what is the evidence base that you have from delivering the programme, and what have you learned from delivering it? Because let's not reinvent the wheel. If we can learn from them when they adopted it in their organisation, then we can learn from that as well. Now, internally, we've got a participation and engagement group, which is a group of people with lived experience. So we took the whole concept to them and said, what do you think? This is what we are hoping to do. This is the programme that we are looking at adopting. And we got overwhelmingly positive feedback from them. And then we met with SMRC themselves. So that is the group in the centre that deliver the training. And we met with them and started the conversation. If we decide this is the programme that we want to bring to Scotland, how do we go about it? And finally, we met with retired course leaders from SMRC to learn from them, find out what their experience is, what can we learn from them. Next slide, please. So the Chronic Disease Self-Management Programme is a 6-week programme that both Joanne and I have referred to throughout the session today. Now, this is a robustly researched and evidence-based 6-week self-management programme. Over the past 38 years, it's been available for quite some time. But a very recent 5-year study by the Stanford University showed that people that accessed the programme became active partners in their own care. They became the experts in their condition, and thinking back to my first slide with the blue arrows, that's exactly where we want our service users to be. They also highlighted that goal setting and action plan is key to change. Fantastic, we've introduced GAP, and also said that people became partnerships with health professionals to find solutions. So moving away from that doer, that caregiver, they then worked with their health professionals to find a solution to the issues that they were having. And finally, they reported that the peer support element coming out of these programmes was hugely beneficial to them. Next slide, please. So the outcomes of the SMRC 6-week programme are many and varied, but these are the main outcomes from it. So people have reported decrease in pain, increased energy, increased physical activity, decrease in depression rates, better communication with healthcare professionals, decreased social role limitations, and an increase in confidence in managing chronic disease. And as a result of that, as an organisation, we decided this is the programme that we want to bring to Scotland and that we want to make available for people living with chronic conditions. Next slide, please. So once we decided this was the model for us, we then had to look at how do we actually bring this to our organisation and how do we actually deliver on this. So we had several meetings with SMRC to discuss purchasing a licence from them. Now, there are various licences that you can purchase from them, so we had to meet with them, have the conversations and work out what was the right licence for us as an organisation. We then had to speak to them about what the leader training looked like, because there are several options for that. So far we have delivered a face-to-face leader training based down in Glasgow. It was over 4 days, and we recruited in master trainers from Northern Ireland who came over and who delivered that training. Now, currently we have got a virtual leader training course running, and that's SMRC themselves from California that are delivering that virtually. So we've got that blended approach to it. And the vision is that by next year, some of our leaders will go and do the master training, and we will then be able to deliver that training to other people. We also had to look at the new facilitator role, and again, refer back to Paula, who will share that with you. And we then had to look, as Joanne said, we want to make sure that volunteers are integral to everything that we do as an organisation. So we wanted to make sure that we could bring volunteers on board and that they would be an integral part to delivering that programme. We then looked internally at what we could do to improve and grow our referral process, because as the linear chart maybe looked like, we were all working as individual teams, and it's quite a new concept to open up and say we're now all under our new model and we're now all working closely together. So we wanted to make sure that 100% of service users that had access to our services were offered the chance of self-management. And then the impact and evaluation. And so this has been a theme, as you'll have seen throughout it. Now, there has been robust evaluation and research of the programme already, but we want to do our own evaluation of that. So we've been doing a lot of work in the background at looking at the process of evaluation and how can we actually prove the impact that this has had on service users, and how can we feed back to the health boards the value of them investing into this programme. Next slide, please. So we then started to review our service specifications in the health board areas we already deliver services, and NHS Grampian were first to come on board and say we would be really excited to deliver the first self-management programme in our area. That has actually just completed this week, and again, Paula will tell you more about that. But NHS Grampian were hugely invested, and especially Therese Lebedis, who is their consultant AHP in stroke, and she was really supportive of us delivering this programme. We will be delivering in NHS Lothian just over the next couple of weeks. And again, just to finish mentioning the impact and evaluation, because that's key to what we're doing. These are pilot programmes, and we want to learn from what we're doing and just make sure we continue to improve. Thank you.
So my name's Paula, and I'm a support self-management facilitator. I've come through the organisation as supported after my stroke, and then on to volunteering, and then into community support, and now this role we've adapted, the facilitator role. So far it's been highly motivating and rewarding as a facilitator, improving the health and well-being, identifying health inequalities and helping others find purpose. I find it's not just a job, it's about seeing the difference that we can all make in other people's lives, and I find that really inspiring and life affirming as well. There's lots of things about the facilitator's role with regards to education and development. It involves skill enhancement, that sense of achievement as well, which I felt. And I just feel that the facilitator role empowers individuals to manage their conditions, and it enables our participants not to live a full life and not just one that's half lived. And that's a message we that's throughout our organisation. I just wanted to give you a wee example as well of how this impact's been really lovely for other people. One of my participants had said that when I first met him that he wasn't going to come along to the session, but his wife made him. So he stayed, but he told me he wasn't going to stay for the whole session. And I said, that's okay, as long as you stay for a cup of tea and a biscuit, and then that's absolutely fine. He stayed for the whole session, and at the end, he said that it was really nice to be part of a group and hearing from other people as well. He found that very helpful. His wife also found that very helpful, and actually for her it was affirming to think, oh, I'm so glad he went, because I knew this is what he needed. So she was part of that support as well. So it's all about us together and making that really positive impact. And so within our group discussion, it was about creating action plans. No pressure for an action plan, because we want people to come back even if they haven't made their action plan, because the whole point in our conversations is, if that person didn't manage to do it, well what was the barrier? Let's problem solve together. And that can be really, really helpful and motivating for people, and we want people to want to come back. So it really stands out within our groups, that sense of community, and it's really meaningful because it comes from a place of understanding with people who are attending our sessions. It's such a collaborative approach, and the way we all see it is life shouldn't be condition-led. It's very much about being person-led. And I think this role creates, a meaningful and impactful difference in the life of others, to help them self-manage, but know that self-management isn't about doing it alone. We're all in it together. We're all self-managing our own lives. So another part within embedding it within our organisation, as Joanne had said, it's been a really positive impact throughout with staff and volunteers as well as participants. And there's such a lovely shift going on. And we're not just empowering, our participants, we're all doing it. And it's a shift towards self-management, and it's about connecting with others in different ways. So we're engaging with staff and putting redefining self-management, and it's a lifestyle, and it's not just for work, it's for every aspect of our life. And as an organisation, I feel like this has had a really positive rippling effect throughout. We're supporting each other for our health and well-being. And I just feel that by enhancing self-management as part of our organisational culture, we're seeing enhanced job satisfaction and well-being amongst all of our team members. And then I think that filters throughout with our volunteers, and we take it into our sessions as well. So there's better engagement, better teamwork, more effective teamwork, and ultimately better outcomes for the people that we are supporting. And we want to transform lives for people's here and now, but then also give them the tools to move forward, but knowing that the door never closes. And I think that's something that can be quite frightening to people when they get that support. They tend to kind of want to hold on to it because they think, well, once I lose this, I'm not going to get it back. And we want to change that statement there, or how people feel. We want people to know that the door never closes. We're still here if you need the support. That actually what we're noticing, people are tending to move forward independently, knowing that we're there, which I think has just been really, really lovely. So our job is to enable people to take control of their lives, and the concept of self-management has to be meaningful to everybody. And the process is about joy and fulfillment, overcoming challenges, and giving people the tools. And just in a conversation before in the breakout rooms, what was really lovely is actually what Joanne highlighted again, is self-management means something different to everybody. But I think how we define it as a lifestyle, in the sense we're all human beings. So when we think back, what do we actually need as human beings? We need good sleep, we need good food, we need support from other people. And what we're doing just now is we're reaching into people, you know, who perhaps have been not able to reach out. And then actually once we offer that support and that guidance and the tools, that's the difference. That's what's going to make the difference to people. It'll be impactful and meaningful. And I adore my job. I think it's very, very special. I feel it's a privilege to be part of someone's journey. I feel that we're all in this life together, and we all need each other, all different points. So for me and everybody here, that's why we've all shown up today, because it's not just about the people. We are the people. You know, we all work together and to make that change. And I just want to say thank you so much for taking the time to listen to me, and hear what I've got to say, but also hear what the people we support are saying as well. You know, it's a privilege seeing people, you know, gain confidence and improve their health outcomes, and just see people happier, just living happier lives. And we're all here for that, and get the support to the challenges. So I appreciate everyone listening to me, and thank you so much.